A hospital in the western city of Bhavnagar. These are COVID patients and there are no doctors to look at them, says the man filming the video. In Pune, the worst affected city in India, people are being given oxygen outside a hospital because it's too full. Patients are struggling to get medical care as India is in the grips of a fierce second wave of COVID-19. 73-year-old Mary Arokyadas was taken to 6 hospitals, none of which had a critical care bed for her. She died on her way to the 7th. Her son Anthony spoke to me from isolation. All these years, she never needed to go to a hospital. And when she did, I couldn't do anything for her. I failed her, he says. Field hospitals built last year to add to existing facilities are already full. This one in Pune is managed by Dr. Sangram Kapare, who's been on the front line since the pandemic began.
So what's different this time around?
Right now, what I'm seeing, a single member of the family gets positive, the entire family is positive. The virulence has gone up, the infectivity ratio has gone up. It is affecting young adults, which is quite surprising.
Last year, it took more than 6 weeks for daily cases to double to the number seen at the worst of the first wave. This year, it's taken less than 10 days for infections to grow twofold to the current high, which has already surpassed 2020's peak. The government says people not following COVID protocols has led to the surge, but many experts believe that's not the main reason.
It cannot explain the kind of surge in cases that we are seeing now currently in India, which clearly suggests that there is a great role for highly infectious variants of the virus which are spreading faster, and some of them might be even having the capacity to escape the immune system.
To make matters worse, dozens of vaccination centres in Mumbai and Maharashtra are closed because of a lack of supplies.
India's health minister says there's no shortage of vaccines. This country has been mass producing them and over the past few months has exported tens of millions of doses. So people who've been turned away from centres like this one are asking where their doses are.
The worst hit areas are in lockdown, but cases are rising rapidly in many other parts of India. That hasn't deterred election campaigns and festival celebrations. It's just the start of an aggressive wave of COVID-19. But this country appears to have let its guard down. Yogita Limai, BBC News.